Hello, welcome to County Courier. I'm Minnie Scipio, and today I'm talking with David Coe, who is the Executive Director for the Colonial Services Board, which is an organization that provides behavioral and mental health services in our community. Welcome, David.
Thank you. Good to be here.
Good. Can you tell me exactly what the Colonial Services Board is and what it is that you do?
We are the Community Services Board that is assigned by the Commonwealth of Virginia to serve a certain set of localities within the Commonwealth. We serve the city of Poquoson, the county of York, city of Williamsburg, and the county of James City. We provide public mental health, intellectual disability, and substance use disorder services.
Okay. Where does the funding come from for the services that you provide?
We will take funding from almost anywhere, but where most of our funding comes from are from federal, state, and local governments. We do charge fees for our services. Just about any commercial insurance we accept, Medicaid, Medicare. We are funded by a number of grant-making organizations, the largest of which is the Williamsburg Community Health Foundation. And we do get some miscellaneous donations from here and there, but by and large it's state, local, federal funding, grants, and fees.
Okay. Who is eligible to receive the services that you provide?
Any citizen of the 4 jurisdictions we've described earlier who may have or thinks that someone in their family or they may have an issue with mental health, intellectual disabilities, or substance use disorders. That includes children, adults, seniors.
Okay, you provide an array of behavioral health services. Can you talk about some of those services? Such as case management. Case management is one of the services that
we have a long list of services we provide. Case management services is provided to individuals whether they have an intellectual disability or a developmental disability, which that would include autism and other disorders of that sort, substance use disorders, or folks with mental illness. It is essentially a coordination, monitoring, and brokering service that helps make sure that individuals' care is coordinated and people are connected to the services they need.
What are some of the services that are coordinated under case management?
Well, it would be any number of services we have inside the organization, whether that be psychiatry or outpatient services or employment services, day services, outpatient, individual group, but it's also services outside the organization. Private providers in the community, schools, private employers, Department of Rehabilitative Services, employment services.
Do you contract with some of those organizations that you just mentioned to provide services?
We contract with a number of organizations. Our largest contract is for early childhood services with Child Development Resources, or CDR. They provide all of the services that we have under our umbrella for early childhood, age birth to 3. They're an excellent organization, and we have had a long-standing relationship with them. We also contract with the Salvation Army for residential services for substance use disorders. We contract for inpatient or residential detoxification services. We contract with the Spirit Works Foundation for peer recovery support services for our substance use disorder population, and the number of contracts goes on. We have many contracts that we manage. Okay,
we'll talk a little bit more later on about some of the residential services and some of the children's services that you do offer. You provide emergency services. How does the emergency services part of what you do, how does that work?
First, the phone number is 220-3200, and that will connect you with a counselor or a pre-screener 24 hours a day, 7 days a week, 365 days a year. We provide on the spot, within a reasonable time of response, ability to assess a person's needs and connect them with any type of emergency respite type service that they may need, whether it be inpatient hospitalization, maybe they just need to be talked down, they need somebody to listen to for a while. It may mean that they're going to need longer term services and we can get them stable until the next morning or through the weekend. But it's essentially there to get a person through the worst part of their crisis and to make sure that they're safe.
Okay. Psychiatric services are provided to patients after an initial screening and intake process. Explain what the psychiatric services are and the types of services that are provided under psychiatric services.
There's a common misperception on television that psychiatrists do lots of talk therapy, and that's not really. Psychiatrists are medical doctors, and we employ 3 full-time psychiatrists and have a couple of part-time folks that are working at like Old Town Medical Center and now at the Lackey Free Clinic. But those doctors are medical doctors. They prescribe medication, they assess medication, they assess the effectiveness of medication. They work within a treatment team setting with everyone's case manager and therapist and so on to wrap services around the individual to make sure that everything from their medication needs to their support needs are met.
Now, you mentioned Lackey Free Clinic and Old Town Medical Center.
Yes.
Do you collaborate with them on providing services for people that they may refer?
Yes. We actually have part-time psychiatrists that are working at both Lackey Free Clinic and at Old Town Medical Center. And through a grant we just received from the Virginia Healthcare Foundation, we now have licensed therapists on a small number of hours each week located at each one of those clinics.
Can you talk a little bit more about motivational services and intensive outpatient counseling that you offer?
Intensive outpatient and motivational services tend to be targeted to the substance use disorder population, or a lot of folks have referred to them as substance abuse population. That population often walks in the door not quite ready to receive services. Someone's pushing them in the door. So motivational services are there to help figure out what it is that's motivating the individual to come in, whether it's being internal force or an external force that's pushing them in the door, and to help motivate them to do the right things to meet the goals that they have. Intensive outpatient services are very intensive, at a minimum of 9 hours per week, of group therapy services that involves drug testing, some individual work, but mostly group work, designed to break down barriers, but also provide a level of care that is as close to inpatient as you can get while the person's able to go home at night. Okay,
okay. You mentioned children's services earlier. Talk about some of the services that you offer that are specifically geared towards children.
Okay, aside from the contract with Child Development Resources, we do all have a board-certified child and adolescent psychiatrist, Dr. Dillon, who's also our medical director that works with us. We have outpatient therapy. We have what's called intensive in-home services, which is designed to go into the home, as the name would imply, and work with the family, with the parents, with the child, to work in the family system to help affect whatever changes may be needed, because the kids that are referred to this program are usually at some risk of being put in a residential placement. And it's much less expensive to go this way.
Now, what age do you start seeing children?
Age 4.
Age 4. Okay.
All the way up through the special ed, 21 years old.
Okay. What is the Greater Williamsburg Child Assessment Center? I've heard some news about the Child Assessment Center that was created, I guess, over the past year and a half.
Just opened the Child Assessment Center a little over a month ago. It's been in planning for 3 years. It's a project of the Community Health Foundation, the Williamsburg Community Health Foundation, that the CSB has been chosen to administer for them. It was a group of 17 agencies that got together, figured out that there was a need for a coordination for children's services in the community, but also a centralized place for assessments to take place where people can be directed, even if they don't know what the issues are coming in, something's going on. What we're there to do on behalf of the foundation is to help families figure out what may be happening through a comprehensive assessment and connect them where they need to go. dealing with insurance, transportation, what type of services that may be clinically indicated, basically matching the service options to the individual or to the family, and then helping make sure that that connection is actually made.
Okay. Where is the Child Assessment Center located?
It's at our office in Williamsburg at 921 Capitol Landing, which is right off of Capitol Landing Road, come off exit 238.
Okay. We're going to take a break right now. When we come back, we'll talk more with David about children's services and residential services.
Hi guys. Hey. Hi Megan. Hey Jessica. Megan, you're a tramp. Ryan Fitch told me you guys made out. Everybody knows. He said your breath smells like garbage, and he almost puked. He says you're the most desperate girl he knows, besides your mom. How many boyfriends does she have anyway? Lots? That zit is huge, zit face. Ugly.
Fruit. What a tasty treat. Fruits packed with potassium and other nutrients can help keep your heart pumping strong during the game. And they give you energy back so you can take on the next activity. Can your food do that? Run, throw, think, eat better. Find out more at smallstep.gov.
Welcome back to County Courier. I'm talking with David Coe, the Executive Director for the Colonial Services Board. David, talk a little bit more about the outpatient services that you provide for children.
Our services are primarily individual services, but we also are offering an expanding array of groups. We are also adding currently and in the next few months, substance use disorder services for adolescents. Among those services that we're connecting with, though, that are somewhat considered not really outpatient, is a new program we just opened a couple of months ago with the Crossroads Group Home that we're providing now for that group of kids therapeutic day treatment services, which is about 3 hours of service every day in the afternoon, designed to provide a pretty intensive behavioral health influence in their lives. And the folks at Crossroads have been fantastic working with us.
Okay, now you mentioned Crossroads. Crossroads is?
It is a group home that is part of the Department of Juvenile Justice, but it's managed by the Group Home Commission, which I think falls under York County, right? Actually.
Thank you. Talk about, you also provide some services at the Merrimack Center.
We do. Since we have a detention center within our service area, we received funding a few years ago to provide both mental health and substance use case management services as well as outpatient services. We do have Dr. Dillon, our child psychiatrist, going in for a few hours a week. So we do have a full-time presence inside the Merrimack Detention Center to work with any behavioral health issues those kids may have. Okay,
now People's Place is a recovery-based clubhouse day support program that's located up in Williamsburg. Who is eligible to participate in the People's Place program?
Adults with a serious mental illness that are interested in and have needs that relate to socialization, to skill building, and who work well within a sort of a more intensive day-long experience working to help manage their own program. We provide staff there, but it's really the consumer's program.
Now, what types of things do they do at People's Place?
Well, they manage their own meals. They are responsible for planning their own activities. They actually do volunteer work. They plan for what the program's going to look like. They'll plan their own activities as far as what field trips or whatever they may take. And they figure out what skills they want to work on as a group and how they want to go about doing that.
And that program operates how often?
Monday through Friday.
Okay. You provide transportation?
We do, for those that do not have transportation. And Medicaid pays for those that have Medicaid, but it's also on the bus line for those up in Upper York County and Williamsburg that may have access on the bus line.
I know that you also provide work services for some of your clients, and I know that you've made some changes in that program over the past year. Talk about your work services program.
For years, we operated what was called Colonial Workshop. It was a sheltered workshop program, and it was a program that worked well for us for a long time, but we decided to go in a different direction because the field in intellectual disabilities has gone in a different direction. And with the population that we're working with, which are becoming more medically fragile, they're aging, not everyone wanted to work anymore, and the environment was tough. So we've moved to what we call an enclave employment model, which has groups of consumers working together in a competitive employment environment with a job coach, providing services, some at the Naval Weapons Station, some with Cook's Nursery, providing landscaping services at Centera Williamsburg Regional Hospital, and printing services, several enclaves we have. Folks have gone from making a few cents or a few dollars an hour to some of our consumers are now getting dental insurance and health insurance and 401ks and very competitive wages.
Now, do you provide the transportation for those clients to those work services as well?
Yes, we do.
Okay. I know you also have several residential apartments or homes in the community where some of your clients live. What is the goal of residential services?
Well, we operate residential services for all three of our population groups. We directly operate two of them. For individuals with intellectual disabilities or mental retardation, it is providing long-term support, long-term care, so that we also in a way that individuals can have a full life, can have a life that's integrated with the rest of the community, but can be in a safe, supportive environment that they thoroughly enjoy and can feel that they have family there.
Now, where are your residential apartments or homes located?
They're located in Lower York County in the Claremont Apartments area. Now, on the mental health side, they're up in Williamsburg, off of Merrimack Trail up in Williamsburg. That is a shorter term model that is moving to a more of a transitional set of services. Individuals that go there are looking at skill building. They're looking at having a supportive place to go while they work into their own recovery.
I know that your numbers are probably limited to the number of people that you can service with residential services. Approximately how many people do you serve in that program?
Well, there are only 16 at any one time with intellectual disabilities. And our number of apartments on the mental health side have actually dropped. We only have 7 beds today. That is because we changed our focus a few years ago from providing long-term sort of arrangements to being more aggressive in helping individuals achieve more independence and recovery. So we actually have more people today moving out into their own homes, getting their own independent apartments, and depending on us less. So our utilization dropped with a change in the model. And we're finding that 7 apartments is providing a greater impact than we used to provide with 16.
Now, how is it determined that someone could become a residential client?
That's going to be based upon assessment. Everything we do is based on assessment, and it would be based up also upon the wishes of the individual or the family, or if they have a guardian or authorized representative. We'd make the assessment. We would say, is this place safe? Is it something that would help meet the clinical goals that they have for themselves and would fit with the other individuals that are there in the apartments, so that we don't have personality conflicts unnecessarily and so on. But it's all based on assessment.
Okay, this may be a tough question. Can you briefly explain what a waiver is? Briefly.
Briefly. Sure. A waiver is a Medicaid, it's a special Medicaid plan that is essentially a plan of care for services and supports for individuals with intellectual disabilities, and in some cases those with a developmental disability. It can include residential services, day support services, can include some level of environmental modifications, like if you have to put ramps in your home and that sort of thing. Some of those funds have been cut, but it's essentially funding a plan of care so that no one has to be in the community without necessary supports.
A few years ago, David, you began facilitating a legislative program for our elected representatives. Can you tell us, has that been beneficial for you?
It has been extremely beneficial for us. We have had, for the first time ever, we've had legislation submitted on our behalf. We've had budget amendments that have been put in, naming us as the beneficiaries of those, where before we really didn't take a proactive or an active stance around legislative issues. We have worked with our local partners, advocacy groups and so on, to develop a common community agenda. So it's not just been a CSB agenda.
Okay, good. Pathways is a program for seniors.
Yes.
Explain some of the programs, the services that are offered through the Pathways program.
It's not as large as it once was. Some funding hits have affected that program. What we're primarily doing there is providing an array of outpatient services to seniors and their family and their caregivers.
Okay. The Colonial Services Board was created in 1971. Do you ever encounter individuals who may not know what the Colonial Services Board is and what it is that you do?
We have a lot of issues with people taking the name Colonial Services Board and not knowing what that means. Colonial means you're probably in Virginia, but not necessarily even in this area. Services is a very nondescriptive term, and board is strange. So we have, as we're looking to become more known in the community and have our services more readily known and sought after, we are actually pursuing a change in our name, which is an interesting dynamic. A term that is much more descriptive for us is Colonial Behavioral Health Services, or Colonial Behavioral Health. So we are planning on having that as a new name around July 1. So more and more publicity is going to be coming out about that. Our logo will change. We're looking at rebranding ourselves.
Okay. One of the things that we missed, I think, in the beginning was talking about how the board, the Colonial Services Board, is set up. Now, who governs you? You have like a board that governs the board?
Yes, that's part of the problem with our name, actually, is what's a board mean? We do have a 15-member board of directors. 6 of those board members are appointed by the York County Board of Supervisors, 5 by the James City Board of Supervisors, and 2 each by the city councils in Poquoson and Williamsburg. And those apportionments are done based upon the relative populations of the areas we serve. They serve up to three 3-year terms, and applications for board membership at the Colonial Services Board or Colonial Behavioral Health is actually done through boards and commissions applications through the locality.
Okay. Tell us where you're located and how someone can get more information about your services. Okay.
Our upper catchment area campus is at 1657 Merrimack Trail, which is on the right on 143, coming up before you get to the 199 interchange there on 143. Down in Lower York, our location is 3804 George Washington Memorial Highway. It's in Harwood Way. It's across from the sort of the dam, the grassy dam area on the backside of the reservoir. So you'll go back in the back left corner of that parking lot, and that's our Grafton office.
Okay, I know you have a website.
We have a website, www.colonialcsb.org. Soon to change. It will roll over, but it will end up changing to www.colcsb.org. www.colonialbh.org.
Okay. David, I want to thank you for coming and talking with us today about the Colonial Services Board and the services that you provide to the community. That's our show for today. Thank you for watching County Courier.